Hey guys, it's Dr. Nate here at Thrive Dental and Orthodontics, and today I'm going to talk to you about overbites, what they are, who has them, is it good, is it bad, and how can we fix it? So let me first off start by saying everybody, well not everybody, but most people have an overbite, and it's not a bad thing. So people come into the office, they come for their consult, and they're like, hey Dr. Nate, I have this overbite, I need to get it fixed, like I should never have an overbite. And I say, that's not necessarily true. Most people have an overbite. An overbite is a good thing. So an overbite is when your top teeth overlap your bottom teeth. And that is a good thing. We want that. But we don't want it to be too much. If it's a deep bite, if it overlaps too much, then that can cause some issues. But let's first go over some different definitions of what an overbite is, because there's definitely a lot of confusion. So an overbite is this. Let me get my models here. An overbite is when the top teeth overlap the bottom teeth too much. Okay, so I had to manipulate the thing here, but it overlaps too much. Okay, that's an overbite, a deep overbite. If it's an overjet, which people don't normally use, the normal public doesn't use, orthodontists use it all the time, but overjet is when your top teeth, when they stick out too much, okay, when they're sticking out too much like this. So that's the two definitions. An overbite is when it overlaps too much, and an overjet is when it sticks out too much. So there you go. Now you know the definitions a little bit better. So when you come in for a consult, you'd be like, hey, Dr. Nate, I don't have an overbite, but I have too much of an overjet. Let's see if you guys actually use that. So now you go, that's the definitions of the overjet versus an overbite. And remember, having an overbite is not a bad thing. You just don't want it to be too much. And so a lot of people will come in and they'll say, hey, yeah, I have that overbite, I need to get it fixed. And they think their bite should be like this. They want their top and bottom teeth to hit together, but that's not good. We do not want that. If your top and bottom teeth hit together like this, you're gonna grind them down. And that's why sometimes you see people in their 50s, 60s, 70s, and their front teeth are teensy, weensy, weensy, little bitty guys. And that's because they've been hitting on this for the whole life, for the past probably 40 years, and it gradually erodes away at those teeth, and that is not good. We don't want our teeth to be small, itty bitty guys. We want them to be big and nice and beautiful. So that's what happens when the top and bottom teeth come together like this, when they're coming end on end is what we say. But what happens when it's the opposite? If you have too big of an overbite, or a deep bite is what we commonly call it. And if you do that, whenever your teeth are moving forward, you're gonna put too much pressure on those front teeth. And the exact same thing's gonna happen, just like you're biting on your teeth like this. If the overbite is too much, you create too much force, and every time you move forward or even kind of side to side, you gradually eat away the tops of those teeth. And that's not a big deal if you do it for, a year or two, not a big deal. But if that is your bite and you're doing that for 20, 30, 40 years, you guessed it, the top teeth and the bottom teeth are gonna get ground down until they're eensy, teensy, weensy again. And we do not want that. We want nice, beautiful, big teeth that are healthy. So that's the consequences of having no overbite, where the top and bottom teeth come together like this, or having too big of an overbite, a deep bite, when they're like this. All right, so you're probably asking yourself, okay, Dr. Nate, I have this overbite, this big, deep overbite, or I don't have any at all, my teeth come together like this. What do I do? And I will tell you, a little bit depends on your age and what you're willing to do. If you are a teen, which is the best time to get braces, I think that is the easiest way to fix a deep bite. So if you come in, you have a big deep bite, or you have an overjet, that is pretty easy to fix with braces. We use lots of different appliances or rubber bands or different kind of tools to make it so your overbite and overjet are good. And I do this basically every single day that I'm working. We fix overbites and overjets. Very, very straightforward, very easy. If you're an adult, yeah, it's not so bad. It gets a little tougher the older we get. But I always tell people there's no age limit for braces. Actually this goes back a long time ago now, I treated a 75-year-old in braces who had a deep bite, and he loved it. He was awesome. So you're saying, hey, you know what? I don't want to get braces. I don't want to get Invisalign. What is a different way to fix it? And there is another way that I don't like as much, but it's still an okay way, and that is a full mouth rehabilitation. A full mouth rehabilitation is way more expensive than getting braces or Invisalign, but what it is basically you're replacing a lot of your teeth with crowns or partial dentures or implants, anything you can to open up your bite with different prostheses. And that is how you're gonna do it with a full mouth rehabilitation. But if you're gonna do that, you definitely wanna go to somebody who knows what they're doing. Most of the time, a prosthodontist is the best person to go to just because it's so difficult, it's so intensive, it's gonna take a long time, and there's lots of different variables that you have to be comfortable with. Because if you're not, you can get some severe TMJ issues. That is something to be aware of. Definitely the easiest thing, the easiest way to get it fixed is braces. All right guys, so there you have it. Now you know the difference between an overbite and an overjet. You know how to fix it, you know the consequences, so you don't need to ask me any more questions, but you can still ask if you need to. And once again, thank you so much for watching. If you're watching, please subscribe below. And if you have any questions or comments, you know I'm doing my best to answer all your questions. Thank you so much for watching, and I'll talk to you guys soon.